This morning, we have already discussed gun violence and its impacts on youth, and we will now be moving on to our second panel of the day discussing COVID-19 and its effects on education. I will now turn it over to Arya and Sarabi, our two moderators for this next panel.
Thank you, Hannah. Good morning, everyone. I hope everyone is doing well. I am Arya Bandy, a rising senior at Harrisburg Academy and an intern for the World Affairs Council of Harrisburg this summer, and I will be one of your moderators for this panel.
Hello, I'm Sarabi Shanmugam, a rising senior at Cumberland Valley High School. Like Arya, I'm also a World Affairs Council of Harrisburg intern, as well as the other moderator for this panel.
We would like to say thank you to everyone who's joining us today, and especially to our panelists for our COVID-19 and education panel.
First, Arya and I will begin with very brief introductions of each of our panelists. So first we have Mr. Eric Turman. Mr. Turman is the superintendent for the Harrisburg School District. As someone who has over 18 years of experience as an educator, Mr. Turman is committed to fostering positive relationships with students, staff, and faculty.
Next, we have Lindsay Bowman, the head of upper and middle school at Harrisburg Academy. She has been with the Harrisburg Academy since 2013, and she also is on the board of the World Affairs Council of Harrisburg and the Pennsylvania Council for the Social Studies.
Next up, we have Dr. Nirmal Joshi. Dr. Joshi was appointed Mount Nittany Health Chief Medical Officer in November of 2017 and was recently named Chief Medical Officer, Population Health. In this role, he provides leadership for clinical operations related to clinical quality, population health, and medical staff.
And lastly, we have Alanis Melendez, who is currently a student at Lebanon High School and one of our interns, and she's here to offer the youth perspective on this topic.
Now we'd like to briefly open the floor up to each of our panelists for some opening remarks. So Mr. Turman, if you'd like to start us off.
Much appreciated, and I want to thank all of the young people for jumping on here today. I know as summer's closing to an end, you're probably trying to enjoy a little bit of relaxation before you start back to school. So also very appreciative of having the opportunity just to speak to some of the topics that are going to be discussed today. So looking forward to the opportunity to share some of my thoughts in terms of some of the effects that COVID are going to have on our young people for the foreseeable future and beyond, and being able to answer any questions for anyone. So thank you for the invite.
Thank you, Mr. Turman. Ms. Bowman, would you like to go next?
Sure, thank you. Hi, everyone. Good morning. I'm really honored to be here and loving that I see so many students involved in these issues, including two of my own. Hi, Arya and Chloe. And, you know, I'm happy, just like Mr. Turman said, to answer any questions and have a discussion about what's going on in our schools.
Thank you, Ms. Bowman. We're very happy to have you here. Dr. Joshi, if you'd like to go next.
Sure. Hello, and thank you for having me. I appreciate the opportunity, both Arya and Surabi, as well as everyone else. So thank you for that. In my role in this context, in the context of COVID and education, I have a clinical background in internal medicine and infectious diseases, and have seen the pandemic sort of on the front lines, if you will, in many ways, and therefore would be happy to share my perspectives as the questions come through about COVID-19's impact on younger communities and populations, particularly school-going communities and populations, with a reminder that despite the fact that, thank God for that, despite the fact that COVID-19 has significantly abated over time in terms of its consequences, particularly in terms of its severe consequences as it relates to hospitalizations and death. However, COVID-19 continues to be a significant public health threat, public health impact, and also a significant disruptor, not just a health consequence, but a significant disruptor to operations in general, whether it be school operations, whether it be education, whether it be hospital operations, whether it be business operations, and so on. Today's context obviously is in the context of education and schools, and we'll focus on that. But the reminder continuing to be that COVID-19 is very much here, posing a significant public health threat and continuing to do so, and is likely to be, based on all predictions, is likely to continue in some way, shape, or form for the foreseeable future. So the ability to learn how to live with it, both in terms of direct health consequences, public health consequences, and policy consequences, some of which we'll discuss today. And I'm eager to hear other members of the panel talk about those kind of implications that they are struggling with on the front lines in school systems and education. So a pleasure to be here and look forward to the questions and comments.
Thank you very much for lending your perspective, Dr. Joshi. Alanis, if you'd like to also provide.
I would like to thank the panelists for being here. I am a student at Alabama High School. I am also the co-president of the student council that we have. And I am here to offer the student's perspective and how my experience with COVID altered my education.
Thank you, Alanis, for your opening remarks, and thank you to everyone again. So if anyone has any questions, please leave them in the Q&A. We'll try to answer as many as we can. And we have our first question from one of our interns, Kennedy Holt. So Kennedy, would you like to ask your question?
Hello, everyone. Thank you for being here with us and for taking the time out to speak with us. So my question is, so there's been a lot of evidence that suggests and proves that communities of racial and ethnic minority groups are disproportionately affected by this virus. Mr. Turman, how are you ensuring the retention rates of students, in particular students of color, throughout this pandemic? Also, what have been your strategies in combating the heightening disparities within educational access and improvement as a result of COVID-19?
All right, those are all very valid questions. I think the part that was very clear to us when we came back to school a year and a half later is the amount of learning loss from K through 12. And I can give you some examples so you can kind of see what I'm saying is, historically, a kid entering kindergarten was, I'd say 60% of them were, about 50% were significantly below level. So a little bit more than half. A year and a half later, kindergarten kids coming back in, you were talking over 80% of them were significantly below level. Your numbers of students who went to pre-K, obviously that was almost non-existent the year we were out of school. Your second grade students at this point in time going into third grade had the biggest struggle. That's where you can see the struggle the most. So, because at kindergarten, they were only in school for 65% of the year, and they were out for the remainder of the year. So all the foundational skills you get as a kindergarten student, a good portion of them were missed. Then their first grade year, they are remote, which did not bode well for majority of the students, especially not a student in first grade. So now you then fast forward, they come back to school in second grade, and those students are now significantly below level in terms of where they need to be. So we are coming up with a couple of models to try and aggressively approach that. We're doing a station rotation model at our elementary and secondary levels to really get down to teachers working with really small groups of kids throughout the course of their ELA block and their math block to really go after the basic skills that each particular kid needs. Because we have to really focus on each child in terms of where they're at, but where we need them to go. So those are some of the academic things we're doing, say elementary. Middle school and high school, the biggest issue that we saw last year was the socialization of students, and students not socializing for a year and a half and then coming back to school. And I don't think there's one superintendent who had an idea of the types of trauma that kids were bringing back to school being out for a year and a half. Some of the behaviors that I saw last school year, I've never seen before in 25 years. And this was students and then also adults. So that was another component that we are aggressively working on. So what we've done is we we move forward with something called Effective School Solutions, where we have clinicians in buildings right now who are taking the top 20 students who really need support almost each and every day. And how do we provide those students with some type of tier level support to really focus and help support them throughout the course of the day so that we can get to their academics. We also contracted with a group called Living Well. And over the next 2 to 3 years, they're going to focus and help us with kind of tier 1 behavior. So, what are the behaviors you're seeing in classrooms, and how can you support students to really be able to focus on their academics as well, and not some of the behavior issues we saw last year. But the other part with that I don't think people don't discuss enough is the trauma that the adults in the community face by kids being out of school for a year and a half, and some of their own concerns and issues. So we are now branching out to how can we support the community? How can we support the parents? Because at the end of the day, if you don't use that approach where you're supporting the kid and the parent, student is now going back into the environment at the end of the day, where if you don't support that parent or that caregiver with some of the concerns and issues that they're going through each and every day, you're not going to make as much progress. So those are just some quick things I can tell you that we're doing to combat that. But I will say is that the learning loss was across the board, but you really saw it at the elementary level, especially the foundational grades. But the behavior piece was like in grades 5 through 12, 5 through 11, where there were just some significant behaviors with students not knowing how to communicate, not knowing how to decompress, and just some of the behaviors. I just saw things escalate very quickly, where I had never seen behavior like that before.
Yes, thank you, Mr. Turman. That's very informational. Ms. Bowman, since you're also an educator, did you have any thoughts on this question at all?
Sure, thank you. I agree about the social emotional aspect, absolutely. That's where, and we're a school that's pre-K through 12. So we have students as young as 3 through seniors, and at different levels that can look different, but the social aspects and then some of the behaviors from that were definitely a challenge. And I would say we're very lucky in our size, as we're a small school. And so we were able to respond very quickly to the pandemic. But when you think about trauma and students and even adults, it often presents itself, after the sort of crisis. And so I think we will continue to see and need to support our students and faculty through the continuing months and years ahead. Because COVID still exists and we still have people getting sick, but also because as people feel safer, that's when they're able to process that trauma. So we're very fortunate that we have a counselor on staff who's amazing and is able to work with our students. And we have built-in social emotional learning programming. So we have structures in place, and we had them in place before COVID. So being able to make those transitions didn't feel quite as difficult, I think, in that process. So that's, yeah.
Thank you. So I see a question in the Q&A section asking, do you think our schools are well prepared to handle future pandemic events? And if not, what do we need to do? So I think Ms. Bowman, you already touched on this, but what do you think?
Yeah, I mean, again, we were small and we were able to pivot really quickly. Schools shut down. It was a Friday the 13th, which was very ironic. But we were already one-to-one with technology. So by the following week, we were up and running with classes and a schedule and able to check in with our students I was teaching at the time. We formed a pandemic team on campus that we met once a week, more if needed. We had a physician's advisory council that we consulted because, none of us are medical professionals, and we wanted to ask the experts before making decisions and making sure that we were making informed decisions for our students and community. So I think, again, having some of those structures in place before and during the pandemic helps us be prepared if something like this were to happen again. I sure hope it doesn't, but I feel like we've learned a lot. Some of the infrastructure with Zoom and technology and online platforms for our students have improved. And hopefully, if this were to happen again, not just my school, but others would be able to respond and get things going for their students more quickly than in 2020.
Thank you so much for that response. Alanis, what are your thoughts on this question?
I believe that it depends on the school as well, because I was lucky enough to have an iPad from my school and have the technology. However, our building is very small within the hallways, so we were not very safe when transitioning. So creating an area where you have that safety net that not a lot of schools have the access to during COVID was really important for my school. So we decided to do a hybrid and alternate having groups of students attend Fridays and Thursdays, and other students attend Mondays and Tuesdays, and leaving Wednesdays for virtual. And it just depends on the community you have and the building and what you think is best for your students.
Thank you. Mr. Turman, would you like to add to this question?
Sure. I mean, I'll be honest with you, it just is how, if this happened again, what that timetable would be. When I say that, you know, if this happened 40 years from now, technology, you know, we don't know where it's going to be. You don't know what you're going to need that span of time from now. So, you know, if it happened within the next 5-10 years, sure. I think we'd be a lot more prepared. But if I look at where education is now, in terms of technology to where it was when I first started, if this would have happened when I first got in education, kids would have just been out of school and that would have been it, because we didn't have Chromebooks. You know, you didn't have devices like you have now. You didn't have the opportunity for a student to do their homework on their phone. So it just really is going to be based on the timing and, you know, where we are with how we do education, or where we are with where technology is, whether or not we would be prepared for that or not.
Thank you so much. Dr. Joshi, how do you think a response to another pandemic event would look like?
Yeah, that's an interesting question. I think that we are much better prepared to be able to, at least in concept, thinking about the kind of issues that come with a pandemic, with a massive impact like COVID. And it's very interesting that if you think about the impact, not just in education, but overall, if you think about the impact of COVID, there is one thing that is the direct impact of the public health threat, right? Of the disease itself, the physical consequences, people dying, disability, death, and just the suffering from the disease itself. And then I think what we learned was that when something new happens, the amount of uncertainty surrounding the actual science, very similar to what we are, in some ways, very similar to what we're dealing with the monkeypox situation right now in several states, particularly in New York, is that it's very interesting how people manage or how the public at large responds to the parts that are uncertain about the disease. And personally, I think one of the largest roadblocks in managing a pandemic is the human response or the layperson's response. So as an example, in COVID, not only did we struggle with what I call certain basic public health interventions, such as masking, for example, to begin with, and then subsequently the significantly divisive kind of point of view regarding vaccines. So those are examples of perhaps some of the biggest threats. So in a direct response to your question, I think areas that we are probably going to be better at are going to be the scientific and the fairly direct interventions and the ability to get vaccines quicker, the ability to get medications cleared through bureaucratic pathways quicker, and so on. So all of that, I think we have learned from and I think have gotten much better at. The parts that we still have to learn a lot about is the human psychology of when people see a threat, how they respond to that threat and how they respond to interventions related to that stress, to that process, particularly in countries that such as ours, which takes pride in freedom, right? Freedom of whatever we do. In very basic fundamental terms, we pride freedom. So and sometimes public health interventions and freedom come at crossroads with each other. And I think that's where a lot of the struggle with the pandemic has been. And I think that's an area, unfortunately, while we've learned quite a bit about how human beings respond to whether it be mandates or whether it being told what to do, I think there is a lot to be learned there. And I think that part has been, all of it has been very humbling. But that part to me, particularly as a healthcare professional, as a physician, has been perhaps the most humbling. How do I convince, whether it be my patients, whether it be their families, and whether it be others who interact with me, how do I convince them of an intervention, whatever that might be, that might have significant health benefits, but that might limit freedom, for example. So I think those areas we are maybe not as far ahead as I would like to see. And but I do think that there is tremendous opportunity to learn in both of those areas. Perhaps the latter, I would like to learn much more about the emotional and the logic-based or lack thereof based responses from the community at large.
Yes, thank you for that. It's very informational, very interesting to hear. Our next question is actually from one of our interns, Danica. So Danica, if you want to unmute yourself and share your question, or I can just read it for you.
Yeah, so my question is, will the COVID vaccine become one of the mandated vaccines that kids need to be in school in the future?
Yeah, I don't know. I'm sure each one of us will have a point of view on that, but I can certainly talk about a couple of medical issues. The policy-related question will remain open, obviously, for at least some time. And different states are managing it differently, and it's a pretty politically charged issue and emotionally charged issue for many. So my intent is not to other than to outline what some of those issues are. But certainly, I'm very happy to present a certain point of view and what I think. So vaccines, if you think about them for public health, curtailment of infectious diseases, have been around for decades and over a century, close to. And the fact of the matter is that there is a very, very strong track record in our country of mandatory vaccination in schools for common infectious diseases. We all know that. That's the standard of care. That's currently what happens, is other than very specifically outlined exceptions, the default mode is that vaccines are mandatory. And the impact of those vaccination efforts, if you will, in our country, have been phenomenal. They are time-tested. They are unequivocally positive when it comes to diminishing the consequences, both the incidence of infectious diseases, whether it be measles, mumps, rubella, chickenpox, you name it, and now obviously hepatitis and many, many others. The impact of vaccination and its effects on decreasing the burden of disease across the board is really unequivocal. You look at the science, and it's flooded with level 1, meaning very good evidence to support that works, and has been pretty standard of care over time. Now, when you then extrapolate that to COVID vaccination and that becoming mandatory, I'll start with my personal opinion as a physician and as an infectious disease professional, and perhaps even as, to some extent, as a health policy individual. I have strong feelings that, or a strong belief that COVID-19 vaccination would confer the same benefits from a public health standpoint that other vaccinations do. Its unique nuances are different than others, but it would do the exact same thing, which is curtail not only disease in specific individuals, in this case children, but also now when you extrapolate that to across communities and across countries and across now the whole world globally, is, if you think about it, one of the biggest reasons pandemics stop or epidemics, this one happens to be a pandemic, but when there are epidemics, one of the biggest reasons epidemics or pandemics die out or peter out, if you will, are when the overall burden of disease becomes so small that the virus does not have enough places to go from one host to another, and eventually finds that it tries to jump 2 or 3 hosts, finds it has no home in any of those 3 homes, it knocks the door of different hosts, finds that there is no home available, and inherently dies at that point. So if there is enough decrease in burden of disease, the theory is, well backed by scientific evidence, that the pandemic then dies out. So there are 2 parts to the vaccine effect, both effectiveness and impact. One is the individual morbidity and mortality that it prevents. In the case of children, more morbidity than mortality, meaning they affect less, obviously much less children, thank God for that, die from the disease. But many children have significant consequences, whether sometimes they seem trivial, but they have remarkable impacts on them as well as people around them. So not only does the vaccine have benefits as far as that goes directly, one person at a time, but then the mandatory the vaccination across the board of children accomplishes the goal of decreasing the overall burden, which when you do that, not only does it, just like I said, have an impact on the potential for stopping and essentially decimating the pandemic, but it also has remarkable consequences from policy making. All of the things you're just hearing about the impact of the pandemic in the school setting, a significant part of that would go away if the incidence went down to close to 0, right? So for all those reasons, and shared by most of our colleagues in the physician community and caregiver community and hospital community and healthcare community, is that there should be a very clear and unequivocal response to having mandatory school vaccinations for COVID-19. Now, that's an opinion backed by science. Then when it comes to that converting into policy, like anything else, there are multiple stakeholders in that policy decision. And that's appropriate. We live in a free country. We don't live in a dictatorial situation. We live in a free country where there are opinions. And the opinions of different stakeholders are valid. There are opinions, genuine opinions from the community at large that broadly fall in the realm of the reasons for vaccine hesitancy, maybe for a different day. But there are opinions around that. There are also opinions about parental freedom of what they can and cannot do with their children. And I'm not saying it's right or wrong, good or bad. I'm simply saying those are the elements of what goes into policy making. And that's part of a robust dialogue around policy making, which I always welcome. I think each one of us should have the ability to make the case for a point of view. And in this case, the different folks who are part of that important discussion are parents, school professionals, healthcare professionals, and ultimately science. So that's where do I see the tide going? I think this will be a while. This is a very, very divisive issue, like most of you know. Different states have had different approaches to this, and some of it is politically driven. I'm not stating one way or another, but some of it is clearly politically driven and motivated. And in some other instances, it's emotionally driven and motivated. Who are you to tell me what to do with my life? It's one of those things. It's emotionally driven. So a lot of those factors are playing. A whole bunch of states have been passing laws that go one way, that says we need to make this mandatory. And a bunch of other states are saying preemptively, including the state of Pennsylvania, preemptively saying, at least one part of the lawmaker machinery saying that they would not support mandatory vaccination. So in summary, my thought as a healthcare professional, as a physician, I'm strongly in favor of mandatory vaccination of all children, like unless there are very specific medical contraindications to vaccination, which goes without saying for any vaccine. If there are medical contraindications, you don't deliver the vaccine, or religious exceptions, like there are already existing religious exceptions. Other than those, I feel, for all the reasons that I just said, I strongly believe in a process similar to other infectious diseases, mandatory vaccination for all children. However, there is a lot between the hand and the mouth between the point that nugget of clinical information becomes a reality in schools. And I'm not smart enough to be able to predict what that's going to be.
Thank you so much for that response. It's very important and informative. Our next question is also from one of our interns. So Hannah, would you like to read your question?
Yeah, absolutely. So these are for the educators, so Mr. Turman and Ms. Bowman. What measures have you put in place, whether in the past couple of years or you're looking forward for this upcoming school year, so that children can not only return to school, but they can stay in school? So especially in regards to teachers and not having enough substitutes. So have you guys taken any measures? Are you planning to?
Mr. Turman, why don't you start for us?
Yeah, that's a good question. And to be very honest with you, it's going to be a rolling answer because it is something where we don't necessarily have the answer yet. I'm sure everybody has heard over the last 2 years the teacher shortage. So I'm going to give you some numbers so you can put it in perspective. In 2009, 11,000 teachers were certified in Pennsylvania to teach. This last May, 4,000 teachers were certified to teach. So I'm going to then give you another number to put in perspective, is the number of teachers that the Philadelphia school system needed that were vacant was 900 in April. So if Philadelphia took 900 of those teachers, there'd be 3,000, a little bit more than 3,000 left for everybody else in the Commonwealth. So the teacher shortage that we have right now is real. It is something that is going to cause us to do education much differently than we've done for years, because we're not going to have a choice. That has been a struggle and a challenge, and it's been a new challenge for a majority of districts. Last year probably hit a lot of urban districts the most. Now what's happening is you're starting to see a lot of the surrounding districts in Dauphin County are starting to get hit by teacher shortages. So some of the aggressive things we've had to do, and we are doing, is we're going after those who are retired, to talk them to come back into teaching, and paying them substantially in order to cover classrooms. We're also going after people who have bachelor's degrees who would like to pursue education as a second career, and aggressively go after training them and getting them back into school. We're also going to have to look at teachers who are willing to teach remotely from home to kids who are in school, and then how we have somebody in the room monitor the classroom and help assist, but the math teacher could be sitting in Kentucky right now. These are some of the different approaches that we have to use because of the shortage of those who are coming out of education. Now, some of the things the district is doing to try to retain teachers is climate and culture means a lot. So how do we, appreciate teachers more and do a better job of that? We also are getting a different type of air purifier that we're putting in the buildings. Where with that air purifier, it'll kill certain things that are in the air that will hopefully prevent the spread of, like they talked about, cold, the flu, COVID within classrooms. And we're also going to continue with our health and safety protocols. The one thing that has concerned me is you don't really hear any chatter about COVID anymore in schools. So I don't hear any conversation about masking. I don't hear any conversation about hand sanitizing, about cleaning classrooms. It's almost like it doesn't exist anymore. But then I get a report every week that's showing me right now the amount of COVID cases is starting to increase over the past month. So we are going to keep these same health and safety protocols that we've always used and keep those in place because we as a district feel it's very serious. And I personally have been very thankful for my community because I've received nothing negative in terms of if we say universal masking, kids with Mary West, I don't hear a peep. Nobody's arguing about it and saying my kid's not wearing a mask. Those have been next to nil. So I've been very fortunate. That's how things has occurred. But the teacher shortage, and not only PA, but across this country, is a concern. You are seeing a large number of teachers not just go to another district, but leave the profession. And that is a concern.
Thank you. Ms. Bowman, would you like to add your thoughts?
Sure, yeah. I think one of the challenges for us during the pandemic was we were very careful about who we let in the building. It was really just students and faculty and essential personnel. So in that time, we had to ask our teachers to cover for each other rather than bringing in outside subs. So we're glad to be bringing in subs again to alleviate some of that pressure on our teachers. We are maintaining all of our sanitation procedures, keeping that sanitizer in the classroom. Our janitors have these ionizing machines. They kind of look like a Ghostbuster when they wear them. It's this thing they put on their back. We have the filtration systems as well, and just extra wiping down of high traffic areas during the day through our maintenance crew. Our pandemic team will continue to meet. We're using Magnus Health for reporting and as a symptom checker. So all of those things will continue, and we're staying very aware of what's going on. I think I agree with Mr. Turman. The response from our community has also been very supportive. If we say that this is what we need to do to keep everyone safe, people are doing it. And I also did not receive any negative feedback, no matter what I was sharing with the community about COVID, which was great. I know not everyone personally agreed, but they were willing to do what was necessary to keep the community safe and to keep students in school. So really what has driven some of our decisions is following what the CDC and the Pennsylvania Department of Health are asking of us, or the state of Pennsylvania in general. Like when there was a universal mask mandate, we were following that. But even, then down to our school level procedures, even if someone disagreed, they were not vocalizing that to us because our priority, if at all possible, is keeping students in the building because we know that's what's best for them, to be here and learning in person with their teachers. So that really drives a lot of our decision making as well. We want to see the kids here.
Thank you for that response.
Yes, so for our next question, I would like to ask, this is for everyone, but how should teachers, or how can teachers change the ways that they teach to make up for gaps that were created due to virtual learning and just being in and out of school during the pandemic? So for this question, I'd actually like to start with Alanis, because it'd probably be nice to get the perspective of someone who is still actively in school.
Thank you. To bridge the gap between what we lost during the pandemic, I would think we should reteach it, but I just don't believe that we would have enough time in the curriculum for that. So I honestly, I'm not a teacher, but I would like to at least reach back on it because when pandemic hit, I was in freshman year of high school and I lost a lot of algebra because of it. And that is a lot of information that I missed. And it is important for the SATs and standardized testing. And you can definitely see that in the scores that are coming out now. So if we could go back and reteach it, or at least have a program set to reteach what we missed, that would be appreciative.
Thank you, Alanis. Ms. Bowman, would you like to speak to this?
Sure, yeah. Right, it's learning loss is a struggle. I think that since we were able to keep learning continuous, we didn't have large gaps. We've seen a little less of that. But again, we're small, so our teachers are willing to work with students, after school, during study halls, in the morning, to make sure that they're feeling comfortable with the material. I think that's the best situation when, if depending on what the student is feeling like they need extra help in or what they might have missed, that individualized attention rather than just a blanket, reteaching of something. But if there were large classes that missed large chunks of information, then that certainly would be a possibility. But we're really more focused on one-on-one instruction to get kids feeling comfortable. We have student tutors as well, a peer tutoring program that we love. And I've seen really great progress actually when older students are working with younger students, and they feel a little more comfortable, I think, they share in that struggle and can connect with their experience in a different way than the adult to student. So continuing our peer tutoring program is definitely something that we'll focus on as well.
Thank you for that. Mr. Turman, do you have any thoughts on this question? Or?
Yeah, and I kind of touched on it earlier. You have to focus on each individual student more so now than you did. We've all talked about differentiated instruction for years, but you really have to really focus on each and every kid at this point, and especially the kids who are missing foundational skills. So kind of just going along with Alanis and what you talked about with algebra. Algebra is a foundational skill and is a gateway for so many courses as a high school student in math and also for science. So I could totally understand and get what she's talking about when you talk about her having to take chemistry one day, her having to jump into physics, and how the impact of not having algebra for a year, the impact that would have on her throughout her high school career and possibly after that. So you have to really focus on the needs of each individual student, what he or her needs, in order to really start to move forward. So it's almost an individualized educational plan for every kid, and focusing on what the struggles are for every student to be able to then determine what is needed to help the kids move forward.
Thank you, Mr. Chairman. We just received another question from Kennedy again. So Kennedy, if you'd like to share your question with us.
Yes, so with our teachers being frontline workers, as we all know, our teachers are being underpaid and undervalued while also being expected to stand on the front lines of pandemics, mass shootings, combating inequalities, and systematic institutions and policies. How do we ensure that we are honoring our teachers and staff in a manner in which humanizes their experiences and intentionally serves their workers and attends to their mental health and well-being? And Mr. Turman and Ms. Bowman, both of you can answer that if you can.
I'm happy to jump in. Thank you for that question, Kennedy. I was a teacher during the pandemic. Last year was my first year as the head of the middle and upper schools. So I lived that, and it really stays in the front of my mind as I work with my colleagues in a different way now, and supporting them and being visible to whatever is going on is really important to me. So I think listening has been huge. Teachers know that I may not be able to solve all of the problems, but that I listen and I hear them and I can at least work on something. They value that. They value just being heard, most importantly. And then of course, I like to celebrate as much as possible, as my students know. And I think that we do amazing things here, and the students are amazing, and so are the teachers. And I try to make sure they know that they are sort of cared for and appreciated as often as I can. And then knowing that whatever measures we're putting in place for our students, we're also thinking about their health as well. and taking their concerns into consideration. You know, it's so important that we value the teachers. Like Mr. Turman said earlier, the teacher shortage is a real problem across the country. I have been in different workshops, and I travel a lot in the summers, and I meet with so many teachers through my travels, and everyone is telling the same story, right? And so we want to make sure that we keep the teachers we have, and that we're able to attract new teachers when we need to, based on how we're supporting them and keeping them safe.
Thank you so much for that response. So our next question is for Dr. Joshi. What do you think the schools should do to help students, specifically minority students, to cope with their loss? The COVID-19 unproportionately impacted the minority community.
So that's a tough one, only because I'm clearly talking out of my league when I do, to some extent, because I'm neither a pediatrician nor a psychologist. So just so you know that when I'm talking about this, it's from the vantage point of a general internist who takes care of adult patients for the most part. So with that limitation, the kinds of things I think that have impacted students and you know, have been, one, the physical impact, and then secondly, areas of impact that are much more in the emotional realm. Not that those two are not related, they're intimately related, right? So on the physical side, not just students have not only dealt with the immediate consequences of COVID, being sick for a while with what seems like a bad cold, but when they come back to school, there is a very well described syndrome that is not exactly called long COVID as it's called in adults, but there is a syndrome that's called post-COVID. So students often have ongoing sort of remnant effects, if you will, of COVID that ranges from feeling tired, feeling fatigued, to feeling sort of having somewhat erratic behavior because of they look like they might be more short-tempered, if you will, right? All of these consequences are being better recognized as being a constellation of symptoms that happens post-COVID and can last for extended periods of time, several months. So that's one big bucket of issues that kids deal with. The second bucket of issues are being very well recognized, which have been the social and emotional consequences, which have been categorized in different areas. One of which is when kids for extended lengths of time were at school and not interacting. Needless to say, the issues of depression, isolation, not being able to interface with like-minded, quote unquote, individuals, and so on. So that caused a significant degree of, and a significant burden of mental health illness that ranged from depression to anxiety and other issues. Not to mention that depending on the socioeconomic status that students came from, other confounding variables at home, depending on who was sick, how many people were in the household, elderly people being in the household versus not, and what kind of social support networks they had, what kind of home situations they had. All of that impacted students like it impacted everyone else, but certainly impacted students disproportionately, particularly younger, more impressionable minds, if you will, impacted all of those things significantly. From my perspective, to your question, what can be done, not just from trying to deal with all of this, as well as having lost significant parts of, let's say, the educational process as it would have been had there been no COVID, right? Like one of you mentioned, missing out parts of algebra for a certain period of time. So now think about putting two and two together, that the ability to learn that in a more conventional, I'll use that word broadly, environment, versus now having a significant deficit, for want of a better word, or barrier to learning. And you superimpose that on all the consequences that I just talked to you about, whether it be irritability, whether it be isolation, whether it be depression, whether it be a physical consequence of feeling tired and irritable. You add both of those things, and there is a significant impact to how students then manage their academic expectations, if you will, right? And then finally, to what do we do about it? I think that all of what I just said, an awareness of that, whether it be from the parents, whether it be from the school, whether it be from teachers and so on, is clearly one. And secondly, putting specific sort of systems in place that are able to more patiently deal with these as real issues that students face following COVID. I think that an awareness of them and being able to deal with that helps dealing with them. Not to mention, there are other, and I'll give one or two examples. There is more and more information coming out that there are consequences. As an example, I would call that sort of collateral consequences of mask wearing, as an example. Very well-intentioned, reasons, but then you're now talking inability to read lips, inability to communicate in the way that we conventionally communicate. So there are all these unique small nuances that allow, that if we are more aware of, we are more likely to be able to handle.
Thank you so much for your insight. So this is probably, looking at the time, going to be our last question, but Ms. Joyce, you had a few questions. Would you like to ask one of them?
Oh, well, just one. I just wondered if Alanis would kind of come in, because we're all not knowing what's going to happen in the fall. So I wonder, as a student, how she would react and how her friends might react if schools have to close again for a while, or if your teacher, Ms. Bowman, says you got to put those masks on, it's mandatory. How do you think kids would respond?
Going back to your point of if school closed, I got lots of mixed reviews from my peers. I had a friend who was usually failing a lot of classes, barely making it, until he went online and was getting straight A's. So it just depends on the learning style. I personally, in the beginning, had a lack of motivation to even get on the computer and look at my assignments because there wasn't like any obligation. So it was kind of like fighting that and having to learn a rhythm to actually do work. And I think right now we already know what we're getting into, so it'd be much smoother transition. So if school were to close again, I don't think it'd be that much of a problem for me personally, but for the peers who actually benefit from face-to-face schooling, it would be a problem for them. And I would hate to see what that would do to their education. And for masking, I had no problem masking, but in my area, there was some tussling with that. We had this big sign out of in front of like our school that said like, don't wear your masks and stuff. So it was kind of like having to fight that and just realizing and educating people and having like this discussion about why masks are important. I feel like the one time that they had this like day where you were not required to wear a mask because of what the government said, we had over 50% of people not wearing a mask, which was pretty scary. So I think it would be, for my school at least, it'd be a sort of issue. But again, if we just educate them enough on why it's important to help others, then I think we would be fine.
So Alanis, I think you already touched on this a bit, but as a follow-up question from Hannah, what do you hope to see to change this year?
I hope to see more one-on-one with teachers and just better schooling than the couple of years past. I feel like we miss so much of school and like talking to people and like socializing and just like skills that we missed out on. I hope this year is actually normal because I am going to be a senior and I would like to have a prom. So hopefully nothing bad happens from here to then.
Thank you. So I would love to sit here and have this conversation all day, but I know many people have places to be and we have to continue with the conference. So if we could please have closing remarks from each of the panelists, starting with Mr. Turman.
Well, I just want to once again just appreciate the invite. It's always good to hear from young people in terms of what you're thinking, because I think sometimes as adults we think we have the answer until you listen to young people, and then you kind of gain a different perspective, because our job and what we do is for you. So it's very good to be able to sit and listen and learn and kind of process what you're saying, and some of the things that you shared with us today. So I appreciate all of you for wanting to be leaders in your community as well. It's such a huge accomplishment for all of you that to take a step forward and, you know, to want to lead. Leaders are so important and so needed, not just in the community, but it's in the country. And I wish all of you well as you kind of move forward, you know, through your high school career and beyond. If there's anything you need from any of the panelists, I'm sure any of us will do anything we can to kind of help you out. But I encourage all of you to continue what you're doing now within leadership. It's so important because I got 10 years and I'm done. I'm finished. You know, a lot of us here are like, you know, we're ready to check out and, you know, go to the shore home and ride it out. So we need some of the young people to start stepping up and being these new leaders to lead this country. So I appreciate all of you and the best of luck.
Thank you so much. Ms. Bowman, could you please go next?
Of course. Thank you so much for having me and for organizing this conference. You all have done a wonderful job. I'm so proud, both as an educator and as a member of the World Affairs Council of Harrisburg. I just couldn't be more thrilled with what you're all doing and the tough topics you're tackling. And the future is bright. But yeah, I think, and I hope that you all have a great year and that you feel supported by the adults around you. And I hope that you know that the adults in the schools where you go are doing the best that they can and making the decisions in your best interests. I hope that is what they're doing. It's certainly what we're doing here. And that we all just continue to support each other through this time. It's complicated, right? As we touched on with some things, there are no easy answers, even though I think personally there are. But as a professional and with multiple perspectives to consider and lots of different ages and things in just one building to consider, there's a lot at play. And so I wish everyone lots of health and happiness in the coming year. I don't have a countdown clock. You're probably going to see me here when I'm 90 typing away at my desk. So thank you all so much.
Thank you. Alanis, would you like to go next?
Yes, I would like to thank the panelists once again. I really am thankful that you came and helped me gain perspective on not only the teachers and the health aspect of it. And I would just like to also thank you for this. I really do appreciate everything that's been discussed and having to hear from a student's perspective. So yeah, thank you all.
Thank you. And lastly, Dr. Joshi, could you please go?
Yeah, thank you so much for having me. And much like others, what I appreciate the most is learning from each one of you with the diverse perspectives, not just from the other panelists, from areas that are not directly in healthcare, which is always fun to learn from, and also from, needless to say, from the students who are rising leaders. And my hope for them, obviously, it's wonderful to see the confidence and the comfort with which you conduct yourselves. I'm proud of that, and certainly wonderful to see. So thank you very much for having me.
Thank you so much.
I do believe that we've had a very insightful discussion here today, and we would like to just thank our amazing panelists one more time. So Dr. Joshi, Alanis, Ms. Bowman, Mr. Turman, thank you for being here and taking the time to discuss this very important issue with us. At this point, we will return to Hannah so she can deliver some closing remarks.
Yeah, absolutely. Thanks, Sarabi. I just want to echo the words that both Arya and Sarabi just shared. We're so thankful that you were able to spend some time with us and just share your insight, especially as educators and as healthcare professionals on this very relevant matter. And I want to thank Arya and Sarabi for leading that great discussion. So we are now going to break for a 30-minute lunch. During this time, we will be featuring one of our new podcast episodes from our second season of our Interns podcast. So I invite you and ask you to stick around to hear another great conversation on perhaps a topic we won't cover today, And we will see you all again at 1 p.m. for our next panel. Thanks, guys.